everybody. Dr. Jacqueline here with the Vitality Wellness Center, your guys' chiropractor in the South Denver metro area with the Wellness Way. Coming to you guys again at our new time for Fertility Friday. So today I'm going to talk to everybody about stress, right? None of us have this going on, right? Especially my ladies out there. So I'll wait just a little bit here as we have a couple people popping on before I really get going. So we're really excited to be coming to you guys with this topic today. It's a huge piece of fertility and just normal people feeling good. So if you are dealing with stress, if somebody you know is dealing with stress, make sure you like and share this video with them so that they can have some answers for everything, because this is a topic that is definitely not just for women. So we got a couple people hopping on. Hey, Dr. Brenda, good to see everybody popping on this Friday afternoon. So big deal here, Fertility Friday, specifically surrounding stress. What is this all about? So I really want to talk to you guys about this because it's super important to understand. So who do you think, first of all, stresses more out there? Ladies or guys? And all my women out there are going to laugh because they know the answer to this. Of course it's the ladies. The ladies that stress out more than the guys. And then who do you think causes all the stress to the ladies? The guys. The guys are all the ones that cause the stress to the ladies. Yes, Dr. Brenda, I don't know anyone that has stress. Ha ha ha. Yes, my patients complain about this to me all the time, male or female. This is a really important topic to understand. So obviously there are a lot of things that can cause you to have stress. It can be work, it can be kids, it can be your job, it can be all kinds of stuff, you guys. The key thing is here is that actually will trigger inflammation to happen in the body, which will then trigger a bunch of other things to start happening, which is really not good. So I really want to cover kind of this topic of stress, specifically the hormones surrounding stress, which is cortisol. That's our fertility piece that we're going to talk about today. And that way you can understand this and pass this information on to some other people. So got a couple more people popping on. Hey Annie, hey Dr. Ashlyn, great to see everybody this Friday. So if you guys are dealing with any of these symptoms, I'm going to run through the symptoms of having high cortisol levels. So again, cortisol is the stress hormone. So when we do our testing here in the office, that's the hormone that we're going to test. That is our main stress hormone is cortisol. So anybody out there, when your cortisol levels are high, this is what starts to happen. You may have weight gain, specifically like that belly pooch for all the ladies out there, or guys, that big belly that is just not going away. You could have high cortisol levels. Another big one is like a puffy and a flushed face. So if your face is always red, or you get red very easily in your skin around your face, that's an indicator of some high cortisol levels. Mood swings, this is a big one for all the ladies out there. If you feel like you flip on a dime and you have that threshold, you could already have high cortisol levels, and then you're pushing it even higher, which makes stuff worse. Increased anxiety. Again, this is kind of mood related, mood swing related, but if you feel like you just can't get in front of whatever it is you're dealing with, or if you're having some issues just with anxiety in general, an anxiety attack, a panic attack, things like that, these are all things that you want to consider when you're looking at this. Fatigue or poor sleep. So this is a big one with high cortisol levels, you guys. So cortisol levels should be the highest in the morning. So when you first wake up, so around about 7 a.m. in the morning, you want cortisol levels to be high then, and to kind of peak mid-morning, and then to drop off throughout the day. We want them very low as we start to go to sleep. So if they're high, that can cause us to have really bad sleep patterns and get you not sleeping in those REM cycles, which is your deep sleep cycles. And then that's a problem too, because then you're not getting rested, then you're more stressed out, and then you're tired on top of it all. So really not great. Increased urination. So if you feel like you're peeing all the time, that can be one of two things. Sometimes it indicates that we've got some pre-diabetes or diabetic stuff going on, but it could also indicate cortisol levels are off. So if you feel like you have to pee all the time, it's an important hormone to have checked. For all my ladies out there, this is surrounding that fertility piece. So irregular periods, or you just have fertility problems in general. Problem getting pregnant, problem staying pregnant, between babies, trying to get pregnant maybe a second time if you've been able to do it the first time. So again, these are all things that are important to fertility, but just for overall health for everybody. So I've got a couple people. I've got, Dr. Cynthia and Ross popping on. Hey everybody, great to see you this Friday. So kind of that's that first column here. Couple other things. So definitely a higher susceptibility to infections. So cortisol, you guys, if you don't know, is a really important piece to your immune function, and it does moderate some of your immune function. So if you feel like you get sick easier, you're getting infections easier, your cortisol levels, again, could be off. High blood pressure. So there's a lot of reasons that high blood pressure can happen. Cortisol is one of them. It is a stress hormone, you guys. So obviously if you're under a lot of stress all the time and this is really high in your system all the time, that's going to impact your blood pressure. So high blood pressure is the number one reason why adults, besides their wellness checks every year, go and see their primary care physicians. So it's really important to understand this factor. So if you're under a lot of stress all the time, your cortisol levels could be high, and that could be the reason right there why your blood pressure is high. And it doesn't always take a medication, you guys. It takes a Wellness Way doc like myself or all the other docs across the U.S. digging in deep to understand why that little piece, like what is going on there. Let's not just Band-Aid it. Let's figure out what's going on with it. Acne is a huge one. So for all my teenagers out there, their cortisol levels are already typically high. They have a lot of stress throughout high school. They're growing. They've got school. A lot of times they have athletics or other activities on top of it. That right there could be the reason why we've got all these breakouts happening with the skin. Just checking cortisol levels. Again, that's stress hormone. You also have a higher risk if this stays elevated for a long time of bone fractures, you guys. So not only in my younger women surrounding the fertility piece, but my older women, so my postmenopausal women, this is a really important hormone to check because it does impact your bone health. And so if this is high, you're naturally just going to start leaching all the good stuff out of your bones, which isn't good either. Muscle pains and aches, so it can definitely cause a lot of soreness. You might recover post-workout really slowly compared to some of your friends. So those are all things, again, to consider when looking at this hormone, if it should be tested. Changes in libido. So for both my ladies and my men, if you are ultra stressed out, if you think you're going to want to look at your partner and, have some sexy time with them, no, probably not. That is like the last thing on your brain when you are ultra stressed out under a long period of time. So same thing with the ladies, because a lot of times this deals with the fertility piece, with the libido piece. So they may be so stressed out about trying to get pregnant, and they're tracking everything every month, and they're getting very frustrated because they're not getting pregnant. But then they're like, well, in order to get pregnant, we actually have to have sex. And then they're trying to time all this, and it becomes this giant job, you guys. It's not supposed to be like that. Honestly, when you're working at it that hard and you're like that, all it is going to create your cortisol levels to just go up even higher. So we're actually going to be perpetuating the problem even further, which is not what we want to do. So we really, again, if libido levels are shifting a lot, if we feel like this is a problem, both for men and women, we want to look at cortisol levels. It's an important hormone to look at. Last one is excessive thirst. Cortisol, which you may not know, is actually really involved in your electrolyte balance throughout the blood, and then also in just kind of your overall metabolism. So if it's elevated, you're actually, like you saw over here, you're going to pee more, you're going to create more sweat, things like that, and you're going to lose a bunch of electrolytes, which is, again, going to make you really thirsty. But if you're still stressed out, again, it's just this vicious cycle. You're going to keep hydrating, but you're going to keep peeing it all out. So that is not good either. So if you know of or love anybody that you think is dealing with some of these symptoms, this is just kind of the basic list for having high cortisol levels. Again, this is our stress hormone, and it's a big, big piece in fertility, both for men and for women. So that's why I'm talking about it this Friday. So you say, okay, Dr. J, I've got a bunch of these things going on. What should I do? How do I test this? So I'm going to show you guys right now actually how we test these things in the Wellness Way offices. So we use in our office for most of the time what's called the Dutch test. So this is done by Precision Analytical. It's done with urine, so it's extremely accurate. And this is the basic printout, and then I'll show you the more detailed printout of what specifically our adrenal hormone, our cortisol, how it gets tested. So like I was talking to you guys about earlier, it's really important to understand the cycle that cortisol is naturally supposed to have throughout the day. So upon waking, it should go up, and then it should peak about 30 minutes or so after you wake up. So by the first few hours that you're up, we should hit our peak levels, and then we should see it drop throughout the entire day. And then by nighttime, it should definitely be super, super low, next to nothing, so that we can actually hit our proper sleep cycle. Because if cortisol is high, what happens is melatonin can't kick in and initiate the whole sleep cycle. That's part of our circadian rhythm. So I've seen literally all kinds of patient charts where they might be, that's why it's important to track it also throughout the day. Maybe they start off really good in the morning, but then they I've seen them literally keep increasing throughout the day. I've seen them also start peaking really high early on, and then they just kind of, again, level off throughout the day. Or maybe you have nothing in the morning and you peak in the afternoon, and then you come down. It can look a lot of ways, you guys, and any of that stuff that's out of the normal, that definitely means that your cortisol levels are off. And then obviously our cortisol levels are typically going to be high if they're off. So what we do with the Dutch test is we also test two different pieces of cortisol. So we test the total cortisol here, and then we also test our metabolized cortisol. So it's important to understand that it's actually making that transition through the body, that it's doing what it's supposed to do. It's not all just sticking on one side of it. We also test our DHEA because that's actually how your cortisol is made. That's what it's made from. So it's an androgen hormone, which means it's mostly a male-dominated, typical male-dominated hormone is what we think about it, but ladies still have it too. So this is kind of the basic printout. Then we also have a more detailed printout where we really get into it. We test our melatonin, which, like I was talking about, is really important to understand with the cortisol so that you actually have that proper sleep cycle happening. So we are looking at things like our waking melatonin. We also test it throughout the day. There's another page where we can look at how it's tracking throughout the day. We're testing our total metabolized cortisol. And then what I love is this bottom piece. So it's really, really important to understand these two things. So we've got cortisol, which is our active form, and then we've got cortisone, which is our inactive form. And it's important to have both hanging around your system. You don't want everything activated all the time, and you don't want everything inactivated either, because that's not good as well. So it's really important to have these two kind of balanced. You can see that this particular patient's results, their cortisone is a little bit higher, which is actually good because we don't, again, want cortisol running around the body super, super high at all times. And then what we do through these graphs is we track both and how they both track throughout the day. Because again, we want them both kind of in the normal ranges. So we want the cortisol pattern, which we've been talking about. That's our activated stress hormone. And we want to see the cortisone pattern as well throughout the day. So that's our inactive form, and we want to see them both tracking normally because they both should be present in the body throughout the day. So again, you guys, and then it gives us a little graphic and a printout about which we have more of floating around, and how that tracks throughout the day. So in case you guys didn't know, cortisol is produced in a gland that sits on top of the kidney, so the adrenal gland, which sits on top of the kidneys, and that's how our active form comes out, which is the cortisol. So you may have heard people talk about like adrenal fatigue. Well, they're talking about basically having very high cortisol levels, and then what happens is sometimes when you're chronically stressed over a really, really long period of time, what will happen is the cortisol levels will spike up really high, but then if you're stressed for a really, really long period of time, you actually see the cortisol levels tank. Because again, those adrenal glands basically are fatigued out. You're still producing the hormone, but your body has had so much of it for so long, it just has kind of shut that system down and is trying to kind of deal with it as best as it can. So the body, as you guys know, does not do anything by accident. It always does stuff with purpose. So that's the main thing to understand here. So if your cortisol levels are off, it will definitely influence your menstrual cycles for all my ladies out there. So on the fertility piece of this, if cortisol levels are off, you're going to have a very hard time getting pregnant. And when's the last time an OB tested cortisol levels? They're usually way more concerned about estrogens and progesterone and, things, like LH and FSH. You're rarely going to see an OB, even a fertility specialist, check on cortisol levels. But you guys, as you saw, it's a huge piece to the fertility. So it's really important, and that's why we always test this when we have some type of fertility patient coming in. And you can see that this is literally just one section of the test. There's also a bunch of other little metabolites on another whole page that I didn't even include on this. So with Wellness Way docs, with myself, you're getting a doc that not only understands all this, but can take it to that deeper level and start to put all the puzzle pieces together. Because as you guys know, the body is very, very complex. So it's important to understand all this stuff and how it fits together and how, all these things are working together. It's really important to understand the physiology, is what it's called, of the body. And that's where we excel as Wellness Way practitioners. So like I was talking about earlier, those symptoms are the biggest piece of this. So if you know and love somebody dealing with some of these symptoms that I was talking about today, they could have high cortisol levels. It could be other stuff, but these are pretty predominantly cortisol issues. And like I talked about, men or women, it is super important to understand this because it affects every person. We all deal with stress, you guys. I, as a doc, am not immune to it. I am a mom, a wife, a business owner, a chiropractor. I, am an auntie. I'm a sister. We all have these roles in life that cause us stress. Sometimes it comes from our family as much as we love them. Sometimes it comes from our parents as much as we love them. So big takeaway here, you guys. Father's Day is our big day coming up on Sunday. We love all our dads out there. Our dads typically can be the ones stressed out the most. They're trying to take care of the family. They're trying to do the best that they can to take care of everybody. Sometimes it's the moms. Sometimes the moms are trying to kind of hold the fort down. So we love all our moms, but especially our dads. We hope you guys having a fantastic Father's Day this weekend. But if you know and love somebody dealing with some of these symptoms, please like and share this video with them. And if you have any other topics that you'd like me to cover surrounding fertility on Fridays or anything else throughout the week, just comment below, you guys, and I'd love to add it to our running list of stuff that I'll be covering. So look for some more videos. I love connecting with all you. Definitely comment below, and I look forward to sharing some more stuff each Friday at 1. Have a great weekend, everybody.